Adderall XR is a combination medication used to treat attention deficit hyperactivity disorder, ADHD. It works by changing the amounts of certain natural substances in the brain. This medication belongs to a class of drugs known as stimulants and can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. The recommended daily dose of Adderall XR is typically taken once daily in the morning. It is important to take it at the same time each day to maintain the optimal effects of the medication. Before you start taking Adderall XR, make sure to read the medication guide provided by your pharmacist. Take this medication by mouth as directed by your doctor, usually once daily in the morning. You can take it with or without food, but it's important to choose one way and stick to it for every dose. It's best to take it in the morning to avoid trouble sleeping. Swallow the capsules whole and do not crush or chew them, as this can increase the risk of side effects. If you have trouble swallowing the capsules, you can sprinkle the contents on a small amount of applesauce and swallow it right away, followed by a glass of liquid. The dosage will be based on your medical condition and response to treatment, and your doctor may adjust it to find the best dose for you. Take the medication at the same time each day to get the most benefit from it. Your doctor may occasionally recommend stopping the medication to see if there are any changes in your behavior and if the medication is still needed. If you suddenly stop using this medication, you may experience withdrawal symptoms. It's important to follow your doctor's instructions carefully to prevent withdrawal. If the medication stops working well or if your condition doesn't improve, make sure to talk to your doctor. And if you have any questions or concerns, don't hesitate to ask your doctor or pharmacist. Loss of appetite, weight loss, dry mouth, stomach upset/pain, nausea/vomiting, dizziness, headache, diarrhea, fever, nervousness, and trouble sleeping may occur. If any of these effects last or get worse, tell your doctor promptly. Remember that this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. This medication may raise your blood pressure. Check your blood pressure regularly and tell your doctor if the results are high. Tell your doctor right away if you have any serious side effects, including signs of blood flow problems in the fingers or toes, such as coldness, numbness, pain, or skin color changes, unusual wounds on the fingers or toes, mental/mood/behavior changes, such as agitation, aggression, mood swings, depression, abnormal thoughts, thoughts of suicide, uncontrolled movements, continuous chewing movements/teeth grinding, outbursts of words/sounds, change in sexual ability/desire, frequent/prolonged erections, in males. Get medical help right away if you have any very serious side effects, including shortness of breath, chest/jaw/left arm pain, fainting, severe headache, fast/pounding/irregular heartbeat, seizures, weakness on one side of the body, trouble speaking, confusion, swelling ankles/feet, extreme tiredness, blurred vision. This medication may increase serotonin and rarely cause a very serious condition called serotonin syndrome/toxicity. The risk increases if you are also taking other drugs that increase serotonin, so tell your doctor or pharmacist of all the drugs you take, see Drug Interaction section. Get medical help right away if you develop some of the following symptoms: fast heartbeat, hallucinations, loss of coordination, severe dizziness, severe nausea/vomiting/diarrhea, twitching muscles, unexplained fever, unusual agitation/restlessness. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, trouble breathing. This is not a complete list of possible side effects. If you notice other effects not listed above, contact your doctor or pharmacist. Misusing or abusing Adderall XR can lead to serious heart and blood pressure issues, and it can also be habit-forming. It's important to use this medication only as directed by your doctor. If you take Adderall XR for an extended period, you may become dependent on it and experience withdrawal symptoms when you stop. It's important to consult your doctor or pharmacist for more details on how to use Adderall XR properly. Before taking Adderall XR, make sure to inform your doctor or pharmacist if you have any allergies, such as to other sympathomimetic drugs, or if you have any other medical conditions. This medication may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. It's also important to provide your medical history, especially if you have any blood circulation problems, mental/mood conditions, heart problems, high blood pressure, seizures, kidney disease, liver disease, or if you have a history of substance use disorder or uncontrolled muscle movements. This information will help your doctor determine if Adderall XR is the right medication for you. Adderall XR may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you know how this medication affects you. Limiting alcoholic beverages is also recommended, and it's important to talk to your doctor if you are using marijuana. For children, it's important to monitor for potential side effects such as weight loss, as this medication can slow down a child's growth. The doctor may recommend stopping the medication temporarily to reduce this risk. Older adults may also be more sensitive to the side effects of Adderall XR, so be aware of potential symptoms such as chest pain, trouble sleeping, or weight loss. If you are pregnant, only use Adderall XR if it is clearly needed. Discuss the risks and benefits with your doctor, as infants born to mothers dependent on this medication may be born prematurely and have low birth weight. Additionally, this medication passes into breast milk and may have undesirable effects on a nursing infant, so it's important to consult with your doctor before breastfeeding. When taking Adderall XR, it's important to be aware of any potential drug interactions. Always keep a list of all the medications and herbal products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Avoid taking MAO inhibitors with Adderall XR, as it may cause a serious and possibly fatal drug interaction. Make sure to inform your doctor of any MAO inhibitors you may be taking, and ask when it is safe to start or stop taking Adderall XR. Some products may contain ingredients that could increase your heart rate or blood pressure. Be sure to inform your pharmacist of all the products you are using, especially cough and cold products or diet aids, and ask how to use them safely. There is an increased risk of serotonin syndrome/toxicity if you are taking other drugs that increase serotonin, such as certain antidepressants or street drugs. It's important to be cautious when starting or increasing the dose of these drugs while on Adderall XR. It is important to note that dextroamphetamine is very similar to lisdexamfetamine, so do not use medications containing lisdexamfetamine while using Adderall XR. Adderall XR may also interfere with certain medical/lab tests, potentially causing false test results. Be sure to inform lab personnel and all your doctors that you are taking this medication. If someone has taken too much Adderall XR and is experiencing severe symptoms such as passing out or difficulty breathing, it is important to call 911 immediately. Otherwise, contact a poison control center as soon as possible. In the U.S., residents can call their local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. Symptoms of an Adderall XR overdose may include severe or persistent headache, intense changes in mental or mood, seizures, extreme restlessness, and rapid breathing. It's important to always consult your doctor or pharmacist before changing brands or dosage forms of Adderall XR, as not all forms of this medication work the same way. Do not share this medication with others, as it is against the law. Your doctor may conduct lab or medical tests such as blood pressure, heart rate, and growth monitoring in children while you are taking Adderall XR. It's important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Adderall XR, take it as soon as you remember in the morning. If it's later in the day or close to your next dose, just skip the missed dose. Take your next dose at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing Adderall XR, it's important to keep it at room temperature and away from light and moisture. It's best to avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to getting rid of any expired or unused medication, it's important to consult with your pharmacist or local waste disposal company to properly discard the product. And remember, never flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.